Oral care is a critical aspect of nursing in the ICU. Not only does it promote patient comfort, but it also prevents complications like ventilator-associated pneumonia and infections. Let's dive into essential nursing interventions for oral care in the ICU with practical examples you can use right away. First up, conduct regular oral assessments. Perform a comprehensive oral assessment at least once per shift, or more frequently if needed. Inspect the patient's mouth for redness, swelling, lesions, or bleeding. Document your findings and alert the healthcare team if you notice significant changes, such as oral mucositis or thrush next. Implement a standardized oral hygiene protocol. Follow a consistent oral care routine that includes brushing teeth and cleaning the oral cavity twice daily, using evidence-based guidelines. For alert patients, use a soft bristled toothbrush and fluoride toothpaste. For intubated or sedated patients, gently clean the teeth and oral mucosa with oral swabs soaked in mouthwash or saline solution. Don't forget to use moisturizing agents to maintain oral mucosa integrity, especially for patients experiencing dry mouth. Apply a water-based moisturizer or mouth gel every 2 to 4 hours for patients who cannot take fluids orally. Ensure you apply it to the lips and inside the cheeks to prevent cracking and sores. Administering antiseptic mouth rinses is also crucial. Use antiseptic mouthwashes like chlorhexidine gluconate according to your facility's protocols to reduce bacterial load in the mouth and throat. For mechanically ventilated patients, administer chlorhexidine rinses every 12 hours as part of the oral care routine to help prevent VAP. Educate patients and their families about the importance of oral care and how they can assist. Teach family members how to perform oral care using soft swabs or brushes, encouraging their involvement if the patient is alert enough to participate. Proper positioning is essential to minimize aspiration risk during oral care. If the patient is conscious, position them in a semi-upright position. For sedated patients, turn them onto their side to facilitate drainage of secretions and make oral care easier while reducing the risk of aspiration. Regularly monitor for oral care complications such as bleeding, pain, or signs of infection. If a patient experiences increased bleeding or pain during oral care, reassess the technique and products used, and notify the healthcare team of these changes. Accurate and detailed documentation is crucial. Record the frequency of oral care, patient responses, and any abnormalities found during assessments in the patient's medical record. This ensures continuity of care and effective communication with the healthcare team. Finally, collaborate with the healthcare team, including speech therapists and dietitians. For patients with swallowing difficulties, consult with a speech therapist to ensure the oral care plan aligns with their safety and comfort needs. In conclusion, effective oral care in the ICU is essential for preventing complications and ensuring patient comfort. By implementing these nursing interventions, you can significantly impact the health and well-being of critically ill patients. Adapt these interventions to the individual needs of each patient, considering their level of consciousness, mobility, and overall condition. For further reading and guidelines, check out the references listed in the description. Thanks for watching and stay tuned for more essential nursing tips.